on KMBC. Well, the Wound Care Center specializes in treating wounds, chronic wounds that haven't healed in over 30 days. And then what we do is we do have a multidisciplinary team approach that will treat the patient. We also have hyperbaric medicine, and there are certain medical conditions that are appropriate to be treated in hyperbarics.
Hyperbaric oxygen is an adjunct to a wound care. There are some specific wounds that can be greatly aided or assisted in healing by hyperbaric oxygen. It's a treatment modality which we now have here at Holy Cross. It's not just 100% oxygen, but it's 100% oxygen delivered at a very high pressure, approximately 2.4 atmospheres. And that allows the oxygen to be saturated in the plasma. Normally our hemoglobin carries oxygen, and it has a definitive capacity and amount of oxygen it can bring to the cells. But when you use hyperbaric oxygen at 100% oxygen concentration at 2.4 atmospheres, you supersaturate the plasma and allow the plasma to carry a huge amount of oxygen to the ischemic tissues. This causes blood vessels to grow, and it also provides a lot of oxygen to the wound, allowing it to heal quicker.
I've had several cuts that suddenly healed overnight, which was just a bonus, because that's not why I'm taking the treatments. The first 20 minutes, it's like being in an airplane. Your ears start clogging up and you have to swallow. And the last 20 minutes when you're coming back up is the same thing. The tube is clear and you can see out. And occasionally I even actually hit the walls because I don't even realize where they are.
We have a television, DVDs. They can bring DVDs from home and watch them here while they're, relaxing.
And we're very excited about the program and the benefits of the program, which we hope the community will soon be aware of and will facilitate our growth and will benefit from the additional services we have.
I was very skeptical when I started. My wound surgeon referred me here, and both my wound surgeon and my infectious disease doctor said that it facilitated the healing of the wounds in my feet dramatically, expediting the healing. And right now, one of my wounds is completely healed, and the other wound is showing tremendous progress. I come from a medical field, and I did not know about hyperbaric until my wound surgeon referred me here. In fact, when I got here, it was a question because of my medical history whether I was a good candidate, and I had to be referred to other physicians to evaluate me who knew nothing about hyperbarics. I think my experience is that this should be promoted much more by educating doctors on how the therapy is so useful, and to have insurance companies be more receptive to their coverage.
I take care of patients with complex wounds involving trauma and also in multiple diseases like diabetes and venous insufficiency. So I take care of those major wounds and until they heal. I mainly receive complex patients. I use modalities like hyperbaric therapy for management of those complex wounds. I take care of venous ulcers and diabetic foot ulcers that have mainly been for many years in patients, and we are very aggressive into graft them, and most of those patients will require the use of hyperbaric therapy so they can close. I have good results with the patients, principally with those patients of wounds that have developed infections in the bones, osteomyelitis, and patients also that have vascular problems with vascular insufficiency, ischemic wounds. A patient we graft, and the graft from the first days have some problems of attachments, so we can provide hyperbaric therapy to increase their chances of healing. I will recommend hyperbaric therapy to all my colleagues. I think that the hyperbaric therapy had been not used as it should be used, principally in patients that are chronic wounds that they are not healing by conventional therapy. They're lacking of, I believe, of knowledge of colleagues to use hyperbaric therapy. For me, is alarming. They should be using it more frequently, and I have a great experience in wound care, and since I start open relationship and sending patients to this hyperbaric center, the wound care results of my patients have improved dramatically.
In tonight's Up Close, medical treatment is catching the eye of the U.S. military. Hyperbaric chambers, once reserved for deep-sea divers who became ill, are now being used to treat severe brain injuries and PTSD. Here's Randy Gyllenhaal.
The hissing of pressurized air is pumped into a hyperbaric chamber. The machine looks like an iron lung, but works more like a healing potion. Call it oxygen therapy.
They're put on a bed and they're slid into the chamber.
Dr. Michael Lewis runs 6 of these machines. Patients are put inside and the air pressure increases. It's like diving down into the ocean, but you stay dry.
So that would be the equivalent of around 22 feet underwater type of pressure.
The higher pressure forces oxygen deeper into your body, creating new capillaries and blood vessels in previously damaged tissue. More and more, these chambers are being used to treat serious injuries like wounds to muscles and limbs.
Any discomfort or anything?
The doctor has to use a telephone to speak to the patient who's lying inside the glass machine.
I had no idea what it was when I started. I was a little apprehensive, actually.
Paul Mendelson has injuries on both of his feet and he has trouble walking. But after a number of treatments here, he says it's getting better. Doctors are also trying to heal the body's most complicated organ, the human brain.
One of the things that the military is very much looking at is the application of hyperbaric oxygen for head injuries.
Dr. Lewis is also a military vet and sees young men and women coming back from war with traumatic brain injury and PTSD. Headaches, confusion, and a foggy mind. All of it, he says, could be helped by lying in one of these glass tubes.
With hyperbaric oxygen, it can help that healing process by getting oxygen further deeper down to the cellular level of the brain.
The military is studying the benefits of hyperbaric chambers, and Dr. Lewis is offering the treatment for free to any Iraq or Afghanistan vet with a traumatic brain injury.
You know, I almost gave their life in the service of our country. It's our honor to be able to help them get back on their feet again, and we want to make that service available to them at no cost.
The sessions last about an hour each. Most people just lay back and watch TV as the air pressure rises. In Delray Beach, Randy Gyllenhaal, WPBF.
An Arlington man was about to lose his hand after a welding accident, but a new medical treatment, normally reserved for deep-sea divers, kept doctors from amputating it. Only on 7. KETV News Watch 7's Michelle Bandor has more on the first patient to use the hyperbaric medicine in Fremont.
Well, Brandy, it's an old treatment meant to help scuba divers who experience the bends or decompression sickness. Well, now hyperbaric chambers are being used to treat diabetics and people with traumatic injuries outside of Omaha, where there are more farming accidents.
Without his hand, this welder wouldn't be able to put things together.
Try to move your finger around.
Good. Kent Mortensen almost sliced his middle finger right off September 15th when the tailgate of a truck smashed his hand.
Yeah, except for a little piece of skin right here, otherwise it just kind of swung there.
During 2 surgeries, doctors reattached his finger, but then
everything was looking good, and then all of a sudden the infection set in.
An infection doctors feared could spread. They warned Kent he could lose his finger and his left hand.
The amputation was an option that was discussed, and he had a pretty good infection in his hand as well.
Another option new to Fremont, the hyperbaric chamber in the Wound Healing Center, in operation for less than a month. During 10 2-hour-long treatments inside the chamber, Kent was breathing in 100% pure oxygen.
Over the next several days, we saw improvement in the color of the wound and decreased drainage and and overall improvement in healing rather quickly.
These have been proven to promote blood vessel growth, and so more blood, the wound heals better and faster.
Fremont is made up largely of industrial and agricultural work where farming accidents happen often. Well, now with this new treatment in their own town, patients can get help right away, which doctors say is critical in the first 24 to 48 hours.
This is a picture of Kent's infected finger before, and here it is after his hyperbaric oxygen treatments.
I'm ready to go back to work. It's time to go back to work for me.
And doctors hope to get him back to work shortly. He has an appointment next week, and Kent tells me he had never seen a hyperbaric chamber before and was claustrophobic, but he quickly got over that, knowing it could save his finger in his hand. Now, doctors tell me besides traumatic injuries, these treatments are being used to help diabetics too. Reporting live in the Newsplex, Michelle Bandur, KETV, Newswatch 7.
Hi, my name is Mike. I'm the Senior Hyperbaric Technologist at the Citrus Memorial Wound Care and Hyperbaric Center. I'm going to take a couple of minutes and just fill you in a little bit on what hyperbarics is and what we do here at the center. At this center we have 2 monoplace hyperbaric chambers, which means that they are single occupancy, 1-person chambers. The reason we're doing hyperbarics on these patients is because they have chronic non-healing wounds, which means that their wounds have lasted for longer than 6 weeks. We treat a wide array of different wound types. The majority of the things that we treat here are diabetic foot ulcers, osteoradionecrosis, which is radiation injuries that have affected the bone. There's also soft tissue radionecrosis, which affects the soft tissue of the body from radiation damage. One of our other main indications that we treat would be failing flaps and grafts that we get from surgeons when they perform procedures and the area that they did the procedure on is starting to look non-perfused. We will treat hyperbarics and try and salvage that flap or graft. The purpose of hyperbarics is to get oxygen to these wounds that aren't healing for whatever the reason may be, whether it be poor circulation, smoking, things like that, or the other comorbidities that can affect someone's healing rate. But by getting the oxygen down to these wound beds, we're helping promote healthy tissue and get these wounds closed faster. What we do is our patients are treated in a hyperbaric chamber, which, as you can see right to my left here, is a clear acrylic vessel, and it's pressurized to 2 to 2.5 times atmospheric pressure. And these patients are breathing 100% oxygen. The purpose of that is to saturate the patient's bloodstream with this oxygen and basically force feed the oxygen through the body to get to wherever the wound may be and help heal that patient, up to 50% faster. Patients that we're treating in the hyperbaric chambers with these non-healing wounds, I'm going to walk you through a basic day for them. The patients that we treat here, we see 5 days a week for anywhere from 4 to 6 weeks, depending on the type of wound and severity of the wound. The patients that come here are at the point where they know they need to be dedicated to this program. It is an intensive program, but we have very good success with keeping our patients in the chambers and promoting the healing and getting them healed quicker. When they come in to see us, they would come in and change into hyperbaric scrubs like I would wear that are 100% cotton. We use only 100% cotton fabrics to help preserve fire safety in a 100% oxygen environment. Once they change into the hyperbaric scrubs, they would come into the hyperbaric room and we would assess their vitals. We would check their blood pressure, temperature, and pulse, check their lung sounds, and also for diabetic patients with the diabetic foot ulcers, we would check their blood sugars to ensure that they were at a safe level. Once we assess their vitals, we would get them comfortable on the gurney, give them as many pillows and blankets as they require to be comfortable in the chamber, and then we would begin treatment. Once they enter the chambers, their treatment starts. It is 90 minutes long, and they start out at 1 atmosphere, and we pressurize the chamber to anywhere between 2 and 2.5 atmospheres, depending on the type of wound. Once they're in the chamber and they're at their depth, the time is theirs. They're free to lay there, and we have plasma TVs with DVD players for them to watch movies. They can spend their time how they like. If they would like to take a nap, they're encouraged to. Once their 90 minutes is up, they The technician that's chamber side the entire time would begin to bring them back up to surface. Once they reach surface, after about 8 minutes of ascent to the surface, we would take them out, reassess their vitals, make sure the patients are stable, and assess any concerns they have, whether it be physician contact, anything like that, we would take care of for them. Once they're done, if they have wounds that need to be assessed, they would go straight over to a wound care room and be assessed by our certified nurses. If they don't require a bandage change that day, the day is theirs, they're free to leave, and we would see them back the next day.
Hello, I'm Dr. Craig Reynolds. I'm a plastic surgeon and the medical director of the Wound Care Center at St. Anthony's North Hospital. I wanted to take a moment and talk to you about hyperbaric oxygen therapy. Hyperbaric oxygen therapy is used to treat the most difficult wounds. Here at the St. Anthony's North Hospital, we are one of only 2 centers in the metropolitan Denver area with hyperbaric oxygen therapy capability. Hyperbaric oxygen therapy is used primarily to treat wounds such as diabetic wounds on the feet, infections in the bone which are not responding to antibiotic treatment, and ulcers that are caused by radiation therapy that has been used to treat cancer. The way that hyperbaric oxygen therapy works is a patient is placed into a chamber such as this one here, where they undergo a series of treatments where they breathe 100% oxygen at about twice the normal pressure that we are surrounded by here on Earth. What that does is it works in several ways. The first thing that it does is it provides extremely high levels of oxygen into the tissue. The better oxygenation a tissue has, the better it is able to heal and fight infection. Secondly, these high levels of oxygen actually kill the bacteria, making the antibiotics more effective. And third, it actually causes new blood vessels to grow into the tissue, which is especially important in patients with diabetes and the poor circulation that comes from that disease. We have a team of wound care specialists here at the Wound Care Center at St. Anthony's North, including plastic surgeons, foot and ankle specialists, general surgeons and vascular surgeons, as well as infection experts to help treat all kinds of chronic problems. If we can help you with any sort of wound, please contact us, either directly through this website or by calling us at 303-430-3220. Thank you.